What up? This is Caroline with the CWC podcast, where we believe that life without your favorite foods is not worth living. I'm going to be talking a lot about my journey to food freedom, and of course, I will always keep it real by sharing the good, the bad, and of course, the ugly. I'm going to jump right in and get started and do a little intro first, and then we will just dive right in. I first off just want to say I'm really grateful for you for coming on the show. This is huge to me, and it's something that's very near and dear to my heart. I know that you know that. I spend a lot of my time outside of just my work talking to women about breast implant illness and explant surgery and all of that stuff. And so when I came across your page, I was so intrigued by the fact that you pretty much now specialize. Would you say that that's correct? You specialize in explant surgeries?
Yeah, absolutely. I mean, if you look at my practice, it's probably 90 to 95% of what I do.
Wow. Okay. That's what I thought. So for those of you who are not familiar with Dr. Rankin, he is one of the top plastic surgeons in the nation. He has been practicing plastic surgery for going on 18 years, specializing in explant surgery. What really made you decide, or at what time did you shift into specifically just explanting?
It's been, I'd say about 4 years now where I'm really doing it day in and day out. When I started practice, I just kind of let my practice take me where it went. And I did all types of trauma, reconstructive. I did 15 years at a major trauma institution, taking care of accident victims. I used to do a lot of breast augmentations. I, like many of my colleagues, thought they were totally fine, totally safe. And, I started to have a subset of women that were coming to see me that wanted their implants out. And I reluctantly, I started to do it, and they all started to feel better. And then I started to say, there's really something to this.
Right.
And it just kind of snowballed from there, because as I saw the patients improve, that was huge for me as a doctor. And, I wanted to explore it more.
That is amazing. That was kind of what my surgeon had said after I explanted with him and I went for my week post-op. I mean, I remember almost being like tearful because I significantly felt better just 7 days after explanting, and I couldn't believe it. And he said, well, you're about to feel a lot better. Like as the months go by, it will continue to improve. And I just remember being like, it's just so crazy how bad you can feel, and then how quickly you can just almost feel like your body is able to begin repairing and functioning normally again. It's just bizarre to me. And the however many women that I've spoken to, I know that you probably have spoken to so many more and helped so many more. And I just want to say thank you for that, because it's hard to find plastic surgeons who will even acknowledge that it could be a real issue, breast implant illness. And, I know when I went to get my pre-op I was going to get new implants put in before I got my explant. And the surgeon brought it up before I even could say anything. And he was like, well, I don't know if you've heard about breast implant illness. It's not real. Like nothing you read there's no validity to any of it. And I just thought that was odd that he brought that up at my pre-op. It was just because I had never even researched it. So,
yeah. And I think it's relatively, I don't want to say new because it's been around, but the word's kind of getting out, mostly with social media, podcasts, women speaking about their experiences to other women using resources that weren't available 4 or 5 years ago. We didn't have Instagram, we didn't have podcast and Facebook. And now we have all these means of women able to express their feelings and their experiences together. And I think that's been really powerful.
Yeah. And that's really how I even stumbled upon the fact that I thought it could be my implants causing the issues I was experiencing. I literally just started talking to friends who had explanted. And it was through those relationships that I found a sense of calm. I'm not crazy, because a lot of people really do the stuff that you go through, the symptoms, they make you feel like, well, if a doctor can't tell me what's wrong, then maybe something is wrong with my brain. Like maybe I'm like a hypochondriac and I'm making up some of these things. Maybe I'm just tired. Everyone's tired. And you really start to spiral because of how bad you feel and you know something's wrong. And that was the only solace I found, was talking to other women who were like, oh my gosh, I had that same thought in my brain, or I felt like this. And then you start to feel a sense of something deeper is going on. And it's just too coincidental to remove them. And then all of a sudden, all these crazy symptoms you were dealing with just start going away. And that to me was where I was just like, how do you deny this? Like, I understand that there's not an actual official diagnosis for it, but it's certainly real. It's real to me. I went through it and lived it. And I know a lot of women who did as well.
Yeah, absolutely. And, it's a spectrum, of course. Some women are affected horribly and others moderately and others not at all.
Right.
And finding out why, I think is an important issue, moving forward and see if we can, kind of figure this thing out from a physiologic level.
Right. So I did have a bunch of questions that came in from some ladies. So I had a girl ask, would you be able to explain the process for patients who would be traveling out of state for your explant service? Like how many times would they need to visit your office after? How long would they need to stay after the procedure? What does that look like?
Yeah, so we have in our practice explant liaisons that help basically from travel to pre-op, post-op. And once you get a surgical date, you'll get assigned an explant liaison and they'll help walk you through the whole process. Generally, I like my patients to stick around for 7 days if they're out of state. 10 is ideal, but 7 I'm okay with.
Okay.
That gives enough time for some healing to take place. I do use drains. Drains are out by then. And then follow-ups, usually for my out-of-state patients, if they're able to, they can come in to see me. Otherwise, we can do a phone conversation or a Zoom or a FaceTime. I give all my patients my cell phone number, so they're always texting me pictures and questions and things like that. I like to be available if there's an issue.
Yeah, awesome. I've had a lot of girls ask me specifically about you doing their explant, and of course, I just send them straight to to D, and then calling the office and making appointments. But I know that they're eager to hear all of these details. So, and now that I've got you here, this is actually a really good question. One of my female listeners asked, are there other plastic surgeons starting to follow your lead, about accepting breast implant illness, doing more of the en bloc procedure explant?
Yeah, 100%. If you just look at, the colleagues in my area and around the country, there are doctors that are starting to focus more on explants and some of them solely on explanting also.
Wow.
So I think as we see more data, we talk with more women, people are understanding this is something that's real. I mean, what woman whose breasts look great, who they're happy with their implants, goes and takes them out and is happy they did it because they feel so much better. So that tells you so much. It's the last thing that a woman wants to do when she gets the implants. I'm just going to take them out in 5 years. That's a powerful thought.
That makes me feel a lot better just hearing you say that there are more plastic surgeons that are starting to kind of shift towards that. I think it's got to be, like you said, the demand of the word spreading, women talking to other women about it, seeing it on social media. I see a lot more of it now than I ever did. When I first started hearing about it, probably 5 years ago, I almost didn't want to open Pandora's box and I didn't want to click on a post and read. It was very weird, almost like I knew, but I wasn't really experiencing symptoms at the time. So I was like, I don't want to get my brain like going down that rabbit hole. And as the years went on and I did start experiencing symptoms, that's when I was like, okay, I'll look it up. And it was just crazy when you start reading things that you're dealing with it. I mean, it's a whole list and like what those things are. And you're right. When you have like implants, why would you randomly just want to take them out? Most women want to get new implants if it's been 10 years or 11 years. And I mean, it was no question for me, but I know a lot of women do struggle with, well, I don't want to be smaller. I don't want to look flat chested. And you got to kind of be in that place where health wise, if your health is struggling, you don't care. That's where I was. I didn't care.
Yeah. A lot of times it's last resort. They've turned over every stone and went to every doctor, and nobody can give them a diagnosis. And they say, okay, this is what I'm going to try. And thankfully, in the majority of my patients, they have an improvement and relief.
Yeah. And that's, Tamara had her surgery this morning, and she was basically saying the same thing that all women say to me, which is, I'm just scared that I'm going to get them out and then not improve. And of course, that's like the number one thing that you worry about happening. But I don't think I've talked to any one woman that hasn't had significant improvement after explanting and getting them out. And you just have to think at the very base, it's just two foreign objects in your body. And I just think it's so interesting how the capsule that is created around them, I knew nothing about that. And then when I got my pictures, I was like, why are they red? What's the red thing around it?
Yeah, it's your body's way of saying, okay, something's foreign in me. I don't like it. I'm going to put a wall around it. And that's what the capsule is. Yeah.
So crazy. So interesting. Let's see here. I think we already answered this one. Someone asked, what was the aha moment that had you, well, I don't know. Do you still do implants, or do you just basically just specialize in explant?
I just explant. I don't do implants anymore.
Awesome.
I just, explanting, it's tough. There's a lot of challenges, both from a technical standpoint and from an aesthetic standpoint. So there's a lot, I'm still learning. I'm still trying to perfect so that keeps me busy enough where, I'm thinking that implants might be causing an issue in some women. I just think I'll stay with the explant portion. And
I love that. And what you said about like even just the aesthetic part of it, I still have like a little area on the outside where it's almost like it kind of looks like a flap, but I've had a lot of women be like, I don't want that flap on the outside. And I'm like, again, it really, I don't care. But aesthetically, I can see how it would be difficult to take that. And I mean, I know nothing about any of that, but.
Yeah, I mean, you can get little things like that. You can sometimes do a small revision if it was something that bothered you. Those are usually done under local and things like that. Fat grafting is an option too. I'm sure we'll probably get into that a little bit. But, everybody's an individual, and each patient has unique challenges to their surgery. So that's what you kind of got to fine tune for each patient.
Yeah. So let's talk a little bit about you said fat grafting. Is that like a fat transfer?
Yeah.
Okay. So I don't know a lot about that. I didn't have that done. So let's talk about that a little bit.
So for women that explant, maybe they have a little bit of an indent, or, one side is a little bit smaller than the other, or they just want a little bit more volume. Fat grafting is one modality that we have to use your own fat to give you volume. So it's done through liposuction. We use a special canister that collects the fat sterilely, and then it's injected into the patient. Okay. So that's at least an option to gain a little bit more volume after the surgery. However, some of my patients struggle with having enough fat to utilize.
Transfer and move it around, right?
Yeah. Mm-hmm. Yeah.
Okay. What is the best thing to do to prep before having an explant? Like, is there a specific type of diet that is encouraged to follow, or types of workouts, anything like that?
No, just healthy lifestyle. We have a list of medications not to take and medications that are okay to take. Some people recommend like an anti-inflammatory diet because part of this process is inflammation. So if you can get the ball rolling there, that would be fine. But basically just healthy living. Yeah.
Well, and that's what, the inflammation is the number one thing that I realized that was, triggering a lot of the responses that my body was going through, and most other women, is just that your body feels like it's so under attack that it creates inflammation in all of these. That's why everything was so random. I feel like with, you have throat issues. I did bladder issues, mental issues, so many all over the place that it would be hard, I would think, for a doctor to pinpoint like, well, I don't know why and then they just, I think, chalk it up to, well, it's autoimmune. And I still actually just had my blood test done not long ago. And I called Dee because I was freaking out because they were like, well, your ANA to ITR levels are elevated. And that shows like early signs of lupus. And I was like, what? How is that even possible? And she was like, unfortunately, that's normal. She said, as you continue to heal, those levels should go down. So I plan on getting tested again just to see where they're at. But that freaked me out when I saw that.
Yeah, and autoimmune can present in many different organ systems and many different manifestations. So, and we know there's a link. If you look on the FDA website right now under breast implant illness, they're at least listing some of these symptoms, which is a good start.
I saw that.
So, women that don't have other places to turn as far as a diagnosis can think, maybe it is my implants.
Yeah. And the black box warning that was just placed on all implants, I think that is huge that the FDA passed that. And now like that warning has to be there. I think that's a great move.
Yeah, I agree. I think that with any surgery, and this surgery in particular, informed consent is just key.
Right.
You got to know your risks, benefits, alternatives, possible complications. And I think that now you can't just cavalierly, nonchalantly have your surgery thinking you're going to be fine with your implants forever, guaranteed. There's some possible things that can happen.
Yeah. And that's the most important thing you just said is informed consent. Because I've said, I don't know how many times now, that if any of these things were even alluded to, like this could potentially happen, not saying it will. I mean, I think I probably would have thought twice about getting them in the first place. And, I was younger back. I've had mine for 13 years. So I was like early 20s when I got mine in, and I didn't have kids or anything. I was like, whatever, I'll just get them. And I mean, deep down, I think I knew that like I probably shouldn't have done it, but I did it. And I mean, I don't know how much of that. I think a lot of women get it because they want to feel better about themselves, which I don't think there's anything wrong with that. But ultimately, at the end of the day, I am very outspoken about the fact of how dangerous it is, solely based on what I went through alone in my life. And I'm still healing and still going through it. And that's why I just think it's so important to share with as many women as possible so they know. So I know that you don't handle like all the like payment stuff in the office, but a lot of women will contact me and say, I can't afford an explant. I can't, how do I go about doing this? And I just tell them to ask their insurance company. I know a couple of girls have gotten lucky with their insurance company covering it. Maybe like a care credit. Is there anything that you have to input on that?
We offer in-house finance, third-party financing through Care Credit and some other organizations.
I love that.
There's some patients of mine in our community that are actually starting a support group for women that can't afford.
Wow.
Which I was just told about last week, and they asked me if I would, help them. And I said, sure. So for women that may qualify to contact these women and possibly get their implants handled. I mean, I do for severe cases. I'll do pro bono cases here and there. Absolutely. Awesome. For someone that really needs it. It is expensive. Most insurances don't cover it.
Right.
I have patients that'll submit on their own behalf after and get some reimbursement back. And there's codes online and some of the support groups that you can get to do that as well.
Well, that's amazing. That's awesome that they're putting that together to help some women. And like you said, ones that are like a dire case. I have like 2 girls that are super, super sick, and they're like, I don't know what to do. And I'm like, just go ask or just go talk. Like, I don't know what else it's heartbreaking.
Yeah, I totally get it. And, I just try and do my best with patients. If I can help them out, I certainly will do so.
So what do you think will potentially get this even bigger and bigger and bigger, just more people openly discussing it? Do you think that the media will ever pick up any like stories or?
I think there's been a number of stories. A lot of times it's through celebrity because they have a big voice. And I think that, if you look in the last couple of years, there's some big names that have had it done, and it's always a hot button topic. So you see a lot of the major news organizations pick it up. Yeah. So yeah, I do think just word of mouth, some of the social media sites. like Healing by Nicole, I think has over 130,000 women on it. So that's a big, powerful,
it's a huge group
resource. Yeah.
Yeah. Well, that's awesome. I mean, that's like my only wish is that it just continues to kind of snowball and catch steam and more women at least know about it. If they know about it and then they choose not to, that's, one thing. But so what is, let's see here. What is something, we'll get a little bit off topic. So you grew up in Michigan, right?
I did. Yep.
Okay. And you have 3 kids.
I have 3 kids.
10, 11, and 12. What are their names?
My son is Kobe, Kobi. And then I have Quinn, Quin, and Capri.
I love those names.
Thank you.
Aw. So in your off time, when you're not working, what do you enjoy doing? Aside from being with your family, what do you guys enjoy doing?
We love to travel. So we try and wherever we go, we take our kids, try and give them some really cool world experiences that I really didn't do when I was a kid.
Yeah.
Barely went out of the country. So travel is a big thing. Following my kids in their sports activities and other activities. Me personally, I like to work out. I like to run. I like to play the drums. I've played my whole life.
Awesome.
So always kind of like to do stuff with my hands.
I like that. So do you have a favorite drummer or a favorite band?
My favorite drummer's probably Carter Beauford for Dave Matthews Band.
Nice.
I think he's just incredibly talented, and to listen to him and I love that band too. So
yeah, they're a great band.
Probably my favorite. Yeah.
Well, Queen is my favorite band. So what is your favorite Queen song? I have to always ask that.
Favorite Queen song? Probably Bohemian Rhapsody. You got to go with that.
You have to go with Bohemian Rhapsody.
What song is as unique as that song?
None.
There is none. Yeah.
There is none. You're right. I love that you said that. Well, is there anything else that you want to talk about in regards to explanting, breast implant illness, any of that stuff?
I just think when you choose a doctor, like anything in life, experience is key, and just make sure you go to somebody that does a lot of explanting.
Yeah.
It's something that you want to do proper technique. You want to make sure you get the implants out, the capsule out, and have as good of aesthetic result as you can get. And that takes a lot of experience.
And skill. Yeah.
Yeah. And I think that just going back to where women can get good resources online, it's Healing Implant Illness by Nicole and Breast Implant Illness. Instagram is a great resource too. So you got the online website and the Instagram also. I think that you're doing a great thing, spreading the word.
Thanks.
I think it's, for a lot of women, it's a calling because they've been helped, and then how many people can they help? And I think that you've already gone a long way in doing that.
Well, thank you. And I truly feel like it's a calling. I just couldn't not talk about it. And I just want everyone to know, about the risks and all of that. And definitely, like what you said, my number one piece of advice is a lot of women don't know about the capsules. And so they think I just need to get my implants out. And I'm always like, make sure you do the M block. You got to get the full capsules surrounding the implant out as well. So that's a really important piece. Yeah,
that's an important point too, that when people talk about N block, we always go in with the intention of doing an N block. The key really is to do a total capsulectomy or remove the whole capsule, because an N block doesn't always happen.
Okay.
If there's adherence to the chest wall, you have to be really careful and really meticulous on that chest wall. So sometimes you do a 90% N block and then you go and you get the rest.
Wow.
Very carefully. And if you look at the guys that do most explants in the country, including myself and other doctors, if you look at the explant rate, it's probably, or the N block rate, it's probably, 50%.
Wow. I didn't know that.
Yeah. A lot of people think I need an N block. You want the whole capsule out, and the patients that have an N block versus a total capsulectomy, the outcomes and the improvement in their health is the same.
Huh. Interesting. That's a really good piece of information. Well, that was awesome. And I appreciate everything that you said. If you guys are watching, listening, I'm going to be putting Dr. Rankin's Instagram, all of that stuff, his website in the show notes. And then I'll put a couple links to the groups too. That way, if they were wanting someone to follow on Instagram or Facebook, they can kind of have that avenue. But I appreciate you coming on here and talking about this more than I can express. And I just think what you're doing is so amazing. You and Dee has been so incredibly helpful to me. After she saw the live I did with Tamara, she reached out to me and gave me her phone number and has called me multiple times and talked me off a ledge. And I just think that you guys are wonderful humans, and I appreciate you doing this.
Thank you very much. It's my pleasure. I enjoyed speaking with you.
Thank you for checking out the CWC podcast. If you want to learn more about our community, make sure to check out the show notes.